Welcome, everyone, to the NUSAI Health Community. This initiative, brought to you by the Alice Lee Center for Nursing Studies, ALCANS, at the Yon Luoline School of Medicine, National University of Singapore, NUS, is part of the NUSAI Community of Practice, NUSAI CA. Our primary aim is to educate healthcare professionals on the application of artificial intelligence, AI, in healthcare. This project is funded by the NUS Center for Teaching, Learning, and Technology, CTLT, Teaching Enhancement Grants, TEG, FY 2023/2024. Within our learning community, we offer foundational AI knowledge and skills tailored specifically for healthcare professionals. We also promote collaboration and share AI-integrated teaching plans for healthcare education among local and international participants. Allow me to introduce the dedicated members of the NUSAI Health Community who contribute their expertise and enthusiasm towards leveraging AI for the betterment of healthcare. We also extend our gratitude to NUS Center for Teaching, Learning, and Technology, CTLT, for their invaluable contributions towards funding and publicity, which have been instrumental in making our community thrive. But that's not all. Brace yourselves for our monthly webinars featuring expert speakers delving into AI and its myriad applications in healthcare industry and education. Additionally, our platform serves as a hub for learning resources and event updates, ensuring you stay updated of all the latest developments. And if that's not enticing enough, our YouTube channel hosts a wealth of training courses focused on AI in the healthcare industry and education. Don't miss out on the opportunity to be part of this dynamic community. Subscribe to our channel at NUSA Health Community and visit our website to stay tuned for exciting updates on our upcoming events.
Foraging and chewing and digesting. So we became what we are because of all this. Now, so the leaps are bipedalism, walking on two legs, 5 to 10 million years ago, fire 700 years ago, electricity in 1752. And then now in 1950s, actually AI started. Now in 2020 plus, AI is making a lot of difference. So this is the CEO of Alphabet who says AI could have more profound implications for humanity than electricity or fire. And that's a very important statement, and we need to understand it very clearly. So currently we talk about AI, big data, chips, clouds, automation algorithms. So data is the new oil. So whoever has data will be rich, okay? That's the way it is. And in healthcare, so much data is there. So how to use this data effectively? How to use it with prudence and without breaches? That is a challenge, and everyone has to be part of it. Now let us take a step back, look at AI. AI is there for a long time. Computer science, philosophy, mathematics, psychology, and philosophy applied to different things. Robotics for a long time, language and image understanding, theorem proving, game playing, reasoning, learning, planning, perception, etc. So this is there for a long time. And I still remember my first AI project during my PhD was if you have different symptoms and how do you develop a expert system to diagnose. So that was one of my earliest AI applications. So AI is part science and also part engineering. It is being applied to different fields. Now, if you look at humans, we think like humans, like the thought process. And behaviors act like humans. That's what we say human. But we also want systems which are rational and will act rationally. So these are very important. So can AI be rational and also be more human or more or less like human? And I like this particular quote: intelligence is what you use when you do not know what
recording in progress.
When you are in a new country, you do that. In 96, I went to South Korea, new language, new culture, new food, and everything was new to me. I survived because of the intelligence I have. So what is AI? Basically, to categorize or label data to different classes based on certain features, and also be able to predict the classes or category of new unseen data based on learned patterns. So in email, it is spam or not spam, whether it can filter. But there is a big issue. AI is considered as a black box. We don't know what is inside. But lately, or it is there for some time, people talk about explainable AI also. How to explain? The traditionally non-explainable AI, you have training data set, artificial intelligence or machine learning model, which is learned with the data. And when a new data comes, this model will give a decision or action. The user can use it, but the user will not know why the model decided so. How sure the model is. How is there any case of error? Are there any biases? Why should I trust the model? This is very important in healthcare because healthcare professionals have so much of data and so much of experience. So much is there in them, especially in experts. But explainable AI will give an explainable model, and there will be an explanation interface. And that will help the user understand, I understand better, and I can trust the model. That is the way to go eventually. But where do we stand? So in order to understand that, we need to understand our own intelligence. Are we good at it, or aren't we good at it? So simple example, milk, true mammal, false non-mammal, feathers, true bird, false fins, true fish, false backbone, true reptile insect. So we have this decision tree we have learned from in our life. I like to talk about two cases. One is my own, one is the Nipah virus in 2018. So Nipah was, nobody knew about Nipah at that time. This happened in the state called Kerala, where I come from, May 2018. That was the first in South India. 17 deaths, 18 confirmed cases. And there is a movie about this called Virus, 2019 film in Netflix. So I may be saying something which is inspired by that movie. So what I heard is the symptoms were not exactly able to map to the non-diseases. So someone said, it has got certain symptoms, but it doesn't have this. So it cannot be these diseases. And someone else said, oh, it has something unique, different. So it cannot be some other diseases. So they were trying to use the available knowledge to, trying to narrow down to certain area by saying no to so many other situations or scenarios or diseases. And they came to know that it is not something we know. So when we don't know something, we have to do further analysis. That's why the samples were collected and sent to a national laboratory, and immediately it was recognized and it was contained. So a number of healthcare professionals lost their life. So here, if an AI algorithm was there, because at the national laboratory, they had the knowledge, but that knowledge was not there everywhere. So the moment a knowledge is anywhere in the world, AI algorithm learns, and that is used across the world, the humanity will get benefited. Now, I like to talk about my case. I had DVT, deep vein thrombosis, in 2001, severe shooting pain in one of the lower leg calves. Could not diagnose in the first instance as there was no swelling on the calf. So swelling is a symptom, but I had severe shooting pain. I had 4 clots, 2 in the lower abdomen and 2 in the thighs, 2 thighs. But only one leg had severe, shooting pain. So why it was not diagnosed? And then I called my friend's wife, and she was a registrar at that time. Within 1 minute over phone, she could diagnose that. And she asked me, take a cab, go to the hospital, don't move. See, when I was not allowed to go to the toilet. So such situations where certain symptoms normally seen 99% of the time, but 1% of the time, the symptom is not there, we should not do the false diagnosis. So that is also one way AI will give a probability of this being DVT, high chance of DVT. Then the experts can do more analysis. So these two examples highlight the, case for using AI. So AI can revolutionize healthcare diagnosis, faster analysis with a lot of data, and the accuracy can be improved. And of course, the human experts can add on to that. And possibly, if continuous data is available, or data available for a period of time, maybe early disease detection possible. However, we have to be very mindful that AI is a tool to assist the healthcare professionals and not to replace them. So it will revolutionize it with where human experts remaining crucial, and we have to be very mindful about the quality of the data, whether enough data is there, whether the data is comprehensive, and whether this data is biased. So there are situations where data could be biased. So even in my case, maybe I am one unique case, and majority of the cases had swelling on the leg, and that is called the overwhelming data on one side, which is biasing the classification. And this is the biggest problem in any data, even in manufacturing, even in engineering, and it'll be also there wherever data is utilized. So we have to use responsibly in collaboration with human experts. So let us understand how to use AI. And to understand that, we need to know the principles behind it. And the principles are mathematics. And I'll try to explain with minimum mathematics here, okay? Now, suppose we want to categorize fish, bird, amphibian. We know certain features are similar, and we cluster them, put them together. So we have something like fishes, birds, and amphibians. So the fishes features are among them, within them, closer to each other. And if you look at the distance from fishes to birds, they are far apart. Certain features are quite contrasting. Now, birds, for example, were given the paintings of Van Gogh and Chagall, and pigeons were placed with TV showing paintings in a Skinner box, and they were rewarded with food when the correct artist is picked. And pigeons could do 85% of the time, they did it correctly. Even pigeons can differentiate it. They do not know anything about Van Gogh. They do not know anything about Chagall. They don't know anything about the way we perceive these paintings. They perceive differently. Still, they are capable of doing that. How do they do it? With features, certain features. We don't remember the minute details of anyone's face, but we still recognize that face. That is because certain features are unique. Now, this comes to what is known as classification. So here, for the sake of explaining, I used circles, crosses, and squares Actually, data doesn't have these color variations and or the shape variations. The shapes and colors are meant for humans to look at it. Now, in this case, you can very well see that there are three classes. So we need two lines to separate them into three classes. So how do you draw these lines? Another example is domestication of animals with respect to size. Can we draw lines to separate them? It's not very easy. So it need not be straight line. So we have to go for curves. I give another example. These are iris flowers. And if you look at them, again, for the sake of human eye, we used circle, plus, and diamond with different colors. Now you can say that the shapes and colors are used to differentiate, and it is possible to draw a line to at least separate sedosa from the other two. But you cannot separate versicolor and virginica. But here, sorry. So here, this straight line, how do we draw that? And that's where maths comes in. You can draw straight lines going through the origin, infinite number of things. You can draw in whichever way we want it. But going through the origin is a constraint. So we need to change that. So we call that in maths, elementary maths, y equal to the slope times x, mass m times x. But you adding something else to this, a bias, b. This bias is not the human bias. This is a bias required for the line to go left or right, move up or down, so that you'll be able to classify properly. And this is in 2 dimensions. It's easy to visualize, but we talk about in the AI hundreds of dimensions, thousands of dimensions, hundreds of thousands of dimensions, and millions in some cases that human cannot visualize. Now, this is very interesting in the sense you can vary m and b, 2 tunable parameters, the slope and the intercept, you can vary. That is what is known as learning in AI. Certain parameters are tuned properly. And you can say that X is a feature, Y is another feature. X can be a particular measurement by using biosensor. Urine sample, you have, say, 2 aspects measured, maybe the pH value and something else. Then you'll be able to draw and see few patients lie on the more likely side, sure, and few people lie on the left side. So how do you find this slope and this bias? That is all about AI. So, classification cannot be done always with straight lines. So the classification involves separating data points to distinct categories, and data distribution. In real world complex situations, there'll be quite a lot of complex scenarios. So iris flower I mentioned, it's not easy to separate with a straight line. There'll be multiple dimensions, more than 2, more than 3, hundreds or thousands. And there, it is not the straight line, it's a non-linear relationship that is required to classify them. That's why what is known as, we need to understand what is known as 2 important aspects in AI, classification as well as regression. Classification is drawing a line, will be a curve to separate one from the other. Majority on the upper left side is green, and majority on the lower right is blue or a tint of blue, but there are overlaps. Now, regression is fitting a curve. Can we fit a straight line or a curved line? So regression is curve fitting for prediction. We'll talk about that later. So predict the continuous values like price, salary, age, or even COVID. So line fitting with a lot of data, you can fit a curve where the error is minimized. That's what we say in mathematics. In COVID wave, how the peak is going to come? when it is going to come down, how the second wave is going to come, how did they predict it? So you have data up to certain point, then you can extrapolate it. That's where you need to extend the curve, and it is not straight line anymore. You have to use certain characteristics of the curves, and that we say curve fitting. And how do we do all these things? That's where we can learn from biology. The biological neurons, this is one example, biological neurons, how they work. Based on that, we can create what is known as artificial neural networks. This we know, the Pavlov's experiment. Dog given food after ringing a bell, associating food arrival with ringing of the bell is associate memory. And then the second phase, they started ringing the bell, but food did not come. But then the dog reacted to the first ringing of the bell with so much saliva. And then after some time, the amount of saliva came down, and then it became some minimum saliva. That is called decaying the saliva. And this is the model of a neuron. That's the first model of a biological neuron. It's a very interesting example used in education. So from there, we can try to have a mathematical model for the neurons. This is your area, the cell synapses, dendrites, and synapses from others, dendrites to others. Similarly, we can create a model where a lot of inputs from others come in, you give weightages to them and sum them, and there is a gap, synapse gap, and that gap is nonlinearity. A threshold is to be reached. And in AI, we can define this in different ways. In biological neurons, there are, I worked on long back, there are 14 types of different biological neurons. That was 15 years back I worked on. So I may not be having the latest information. And all those characteristics are nonlinear and natural. So we can have a nonlinear element, which is known as activation function. Inputs go in, weights to the inputs, how much weightage to be given to those inputs. Those are summed, and what is known as local field. This field is very important, crossing the threshold between the synapses. Then an activation function which transforms this local field or value into an output. This is one neuron. And there could be inputs which are tens, thousands, millions. And with, as I mentioned, the straight line, you can draw a lot of straight lines anywhere. Okay, shift left and up and down. And each neuron can define one straight line. So one straight line, second straight line, third straight line. Now, we want to have one straight line and sum it up to one side or other side. You need 3 neurons. This is mathematical, but I'm not going to the details. If you need to have an enclosed space, 1, 2, 3, 4, 5, 6, you need 5 neurons. Or if you want to have very unique shapes to identify certain areas, exclude something within, you need multiple neurons and multiple layers. Or you can try to really have so many straight lines with specific equations, and you can highlight also. But the straight lines are not useful all the time. So you can transform the straight lines using curved paths. And there are very simple functions like sine, cosine, and tan. You might have maybe exposed to that. I don't know. And by combining this, you can create any complex waveform. And that's how these waveforms predicting the COVID was created. I'm making it very simple, okay? And I hope you can relate to that. Now, a number of neurons connected in different ways. You can do classification, class A, B, C. So Chihuahua or muffins. It's a bit confusing, for even for humans. But if you have enough data and enough number of neurons, the AI will be able to do a better job sometimes, better than humans. That's the beauty of it. Regression, what are the features for the house prices? So if you were to buy a house near to the school, near to the shopping mall, near to the workplace, whether the mother's workplace is distance to the mother's workplace is more important, then you can give more weightage to that. So regression is along that. So all this input to output that is actually nonlinear in nature. The surface is highly nonlinear. This example is you go to a restaurant, you eat food, see whether on a scale of 10, good food or not. The service on a scale of 10, then what tip you give. The food is good, service is good, you give more. Less, nothing. So it lies in that. We have this in our brains. For Vivian, it could be a different surface. For Piani, it could be another one. And for me, maybe it's still another. We go to US, it'll change. Go to China or Japan, it'll be totally different. In Japan, tips are not there. So different people have these different mappings. So can we have such mappings? And these lines, they are finer lines. The more fine, the better it is. But then the calculation will be more complex. Less lines, coarse. Easy to calculate, but sometimes you'll be struggling how much to give, $5 or $10 or $5.5. So this is easy to visualize in 2 dimensions and 3 dimensions. But think of 27 dimensions, 100 or 1,000 or million dimensions. We can't do that. Now, this is an example from brain, the superior cerebral peduncle, and better. And how do we go about recognizing certain characteristics from this? So whether it is affected by there is some particular disease or not, or some particular behavior, so characteristics is there or not. So NC and PD, I don't know the details of this. I don't remember now. So there are 3 types of learning. A teacher teaches you, just like A for apple, with colors and shapes, that is supervised. Can be used for classification or regression. In the case of Nipah or COVID, we did not know what it was. So we did clustering and we tried to detect anomaly, the deviation from normalcy. So we had clusters. And there's another one called reinforcement learning. This is very interesting. I give this example, you do cooking at home, say Indian cooking, you have a recipe. You don't know the outcome of the cooking till you finish. So you have to add on to it and then you taste it. Good. But I could have added a little more chili at that particular point in time. I could have put this flame in sim at some other time, little more, little less. So you finish the work and then evaluate it, give rewards to the previous actions. The next time you do it differently and you learn from that. And this has changed the world. And reinforcement learning, where you don't code everything, you can do a lot of automatic coding possible. So the alpha, there's a Japanese game, right? What is that called? Go game, Alpha Go game. So it was not, that program was not written by humans. It was written by another program. And it could think quite different from the experts. And there were some moments where humans, the experts in that Go game, realized that no human on earth will ever think of such a move, because that move is meant to get a reward, maybe so many moves afterward, 2,000, 2 million moves, all possible combinations it could consider. That's the world we are living now, and that we have to be very mindful about. So classification is drawing a line, regression is predicting the future, and clustering is putting similar features. We don't know everything, so put them together, and then you can fit the curve, and if there is a deviation from the normalcy, that is anomaly detection. And into reinforcement learning, where somebody acts in the environment, and the states of that process changes with respect to certain actions, and then you learn from that. So that is a very simple overview. Now, you look at it from a longer perspective. 1950s AI came, and AI died long back, but then machine learning came in 80, and then again there was a limitation, what can be done. Then 2010 deep learning came, and that transformed the whole thing. And now we can do wonders with this. So deep learning is where the features are automatically learned. In traditional machine learning, the feature is engineered by humans. That's the difference. So the next slide will explain that. So certain input feature is extracted, width, length, color, shape, and then the classify and learning happens. And whenever your picture is given to the neural network, it will say whether it is a car or not a car. But deep learning, the human is not required. And that's where it makes a lot of difference. I just want to give one very interesting slide here, where there is what is known as genetic algorithm using X and Y chromosomes. So combinations of X and Y can be interpreted in terms of zeros and ones. So we have a number of algorithms on this. We also look at bees, ant colony, particle swarm, firefly. Maybe we can explain this in some other time. So the genetic algorithm, parent A, parent B, part of parent A gene, part of parent B gene came together and have an offspring. And mutation is just switching 0 to 1 or 1 to 0. So this is a very interesting algorithm for optimization. And we have used it for quite a lot of applications. It's there for a long time. So AI is about problem solving. And but building an AI system is not very easy. So we need to know how to go about doing it. With so much data, we need to know what pattern and knowledge we can get from the data. So data mining is important in problem solving. So machine learning is a field of AI, learns from data. Algorithms are trained with the historical data. Deep learning is advanced, where complex images, text, and speech can be learned. The natural language processing is now ChatGPT, Google Gemini, all come under this, and is very useful for education. Computer vision is so hot, everywhere it is used. So for example, AI in healthcare, machine learning checks X-rays can be used, identify the patterns with pneumonia, for example, and also to flag potential cases for further evaluation by a doctor. Or you can analyze the medical images, mammogram, to detect potential signs of breast cancer, recognize subtle abnormalities that might be missed by the human eye. Predictive analytics, a lot of data from the patient or patients, then AI can predict the risk involved, what possible potential diseases can happen. So this is the way it is evolving now. And natural language processing, human language, experts talk. Can we capture it and analyze it? Also can analyze patient charts, doctors' notes, even chat logs with virtual assistants. Also, data can be analyzed and present recommendations for healthcare professionals for better decision making. So medical history can be looked at, and suggest the most effective treatment. And this can be, a lot of things can be automated, freeing up the time for doctors and nurses. Now, this is from a very interesting article, 2022, Reliable and Resilient AI and IoT-based Personalized Healthcare Services. So post 2020, personalization and digital wellness is being very much focused on. And connectedness, everything is connected. And COVID accelerated this. Remote monitoring and healthcare, we try to encourage, and that was feasible. And different models came along, and lifelong partnership, digital wellness, all those personalized medicine or customer model evolved. So AI can enhance the health and mental, physical, or psychological. If you look at physical, several data can be measured and monitored and be with the help of biosensors. So I'm not going to, the next few slides are on biosensors. I'm not going to talk too much about it. And the biosensors, the communication, and how it is applied, again, from the same article. So quite a lot of, biosensors and components of biosensors are there: human samples, food samples, cell samples, environmental samples. During COVID, we did all that. Even the hostels in NUS, from the sewage data was collected. So this could be antibody, DNA, enzyme, biometric, or phage. I don't know what phage is, you know better. Those are the bioreceptors. Or transducers, optical, thermal, mass, and electrochemical. There are quite a number of biosensors. So I'm not going to go into this, but modeling health condition and health service, very important, and monitoring also. It could be disease-specific monitoring, environment-specific, and agent-specific, and you can utilize them for better caregiving. Though I am not going to talk about robotics, but AI and robotics are impacting training, research, end-of-life care, treatment, decision-making, diagnosis, early detection, keeping well. So it's about 2:42. I have a couple of slides more. Can we take a little more time, or another 10, 15 minutes?
Please go ahead.
Yeah?
Please go ahead. Can you
you
hear
type?
me?
I can't hear. Yeah,
yes.
I can't hear.
Yes. Yes. Can you see the caption? The caption.
Okay.
Yes.
Okay. Yeah. I'll just finish that. So basically, to improve the treatment process, and a lot of reliance on AI will be there. So you can train to do anything, but you must first define and set up the foundations. If the foundations are weak, it will not be good. So I have two projects going on: acute kidney injury data from hospital, and the pre and intra-operational data can predict. Of course, our data is so small now, but with our whatever data, we can accurately predict about 80 to 85% possibility of a kidney injury. It's very interesting, and we did a lot of analysis. Quite a lot of things can be done. We are also working on digital twin for a ventilator, so that the ventilator setting can be advised by the digital twin based on the real-time measurement of patient data. So that is where digital twin comes. A lot of data from the human can be utilized: genetic, laboratory, imaging, biomedical, behavior, social. So for me, maybe my DVT, I was unique. That's why certain things did not, the typical evaluation did not diagnose it. So it can be a digital twin can be generated. And then the digital twin will be able to say, oh, what is, if the current symptoms are given to the digital twin can say this is the possibility. So much of that is happening in the world right now. This is 2020 digital twin for personalized medicine, genome medicine. Don't work in this. Basically, a particular human's digital twin is created, then you can inject or bring in variations in a number of aspects associated with the healthcare, and create a numerous number of possibilities. And then you give different drugs to those different individual scenarios and what is most effective. So something is more effective, then that can be selected and that medicine can be given. This is a way it is evolving and it is becoming. So identification, diagnosis, personalized treatment, drug discovery and manufacturing. I'm not going to talk about that. Robotic surgery, research and repetitive jobs and treatment design. So also you can have a chat bot for answering patient questions, but be careful about using it. Okay, detection of heart diseases and it can be used in pathology. So effective treatment based on individual health data with predictive analysis is a good area. And better health measurement using microsensors, and then optimize the health and reducing healthcare cost. This is, I see, very, very important. Why do we need to give too many medicines? Can we do the optimal care that is required? So manufacturing deep learning is used for drug discovery. There are some examples, ABIV and IBM. Clinical trial research, this is monitoring biological and other signals to signs of harm or death to participants. So that will be increasing the safety. Replacing repetitive jobs, X-rays, CT scans, AIs are being used. And treatment design, this is what I mentioned. Maintain all the records of the patients and the conditions. Accordingly, AI can provide customized treatment. So rapidly transforming for medical image analysis, predictive analytics, drug discovery and development, robot-assisted surgery and virtual assistants and chatbots are being used. For education, I just touch upon some examples. Personalized learning platform. Different people have different styles of learning. And what we address in the classroom or in laboratory or clinical settings will be for the average. Some people require less time, some people require more time, or some people require a better, different visualization to learn faster. So virtual simulations can be done. So students can practice their skills. So I use this for robotics, but for robotics, we have what highly virtual realistic simulations or digital twin, and all the simulations are done there. Then the finalized, optimized codes only used in the actual hardware. And Gemini, so some of these slides were created by Google Gemini and also ChatGPT. ChatGPT, this is from ChatGPT, interactive learning, writing assistance, assessment and feedback, revision and practice. So Gemini learning, research assistant, concept clarification, exam preparation. I do all these things for a number of my courses. And also similarity detection, essay scoring assistance. There are tools for marking as well. So be mindful, data privacy is crucial to ensure patient data. Algorithmic bias, perpetuate existing biases in healthcare data. Human in the loop is very important. Cannot remove the healthcare professionals. They are required. So personally identifiable information, you know about it, protected health information, how to take care of that, privacy breaches, algorithm biases, misuse of data, we have to be very mindful about. So data sensitivity in terms of security, anonymization, regulatory compliance and transparency and consent from the patients. So we get data from hospitals which is anonymized. So all the patient data removed, the PII is removed, and then we can work on it. So finally, I would like to say machines were good before for simple tasks and not good for complex tasks. And we were good at complex tasks. But we are continuing to be like that. But machines with AI can do much more and maybe better than humans at some point in time or in certain applications. So this is an Avatar movie, and this is the future of digital twins, helping to converse with us, make decisions online. And will there be a virtual human avatar? And all possible experiments can be done there with all the possible potential future diseases being created and antibodies or how to treat them. You can do it early, then we may be able to face COVID-like pandemic better. And AI and robotics is impacting everywhere. So that's where I like to end my talk. And now I don't know how to manage my speaker.
Yeah. So, Vivian, Prof, I think, Prof, can you see the caption? Can you see the caption?
Anyone wants to call me over phone?
Yes, yes. I probably need Vivian to help me. Vivian, you have WhatsApp. Prof, WhatsApp. Could you let him know that we turn on the caption so he can see?
Yes, yeah. But I'll have another meeting at 3, so I'll be running.
Oh, okay. Oh, you be.
So,
but could you let him know now so he can read?
Yes. I will let him know.
Right.
Hello.
Right.
Can you speak? Are you speaking? Yeah or no?
Hello, Prof. You still
No.
cannot hear us, right? Yep. But how can I communicate to him that he need to see the caption?
Maybe you can just type in the chat.
I typing already. He didn't see it. He didn't. Do we have hand language?
Oh yeah, now I can hear.
Okay, perfect.
I don't know what was the problem.
I'm almost using the hand language. All right. So Prof, you can hear us right now. Actually, I type the question in the chat. But by the way, Prof, is excellent presentation. Actually, where you explained to us very clear on how to use AI in healthcare. You can hear, right?
Yeah.
All right.
So Gemini, I'll show my screen. This is, if you have a Gmail account, you can go to gemini.google.com.
I see.
You can just log into that.
Okay.
Gemini, Gemini.
Okay. Do I spell it correctly? Gemini is like the one of the, okay.
Yeah, Gemini. Yeah,
Gemini.
I'll share with the screen.
All right.
Yeah.
Sound like, so it's a free, do we have to pay to use
free.
this?
It's free.
I love the free stuff.
Yeah.
I see.
So now I just typed this, what are features in AI? Explain with a simple example from healthcare application.
I see.
Because I want to explain, I know features, but I want to have an example from healthcare. Okay. So we can say that even the question here, are there any software?
Your screen doesn't move, Prof. So
for personalized learning of AI in healthcare. You can type like that.
Prof, the screen doesn't share. Maybe.
You don't see that?
No, it doesn't move. It doesn't move yet.
Okay. Sorry.
Could you please?
Okay, I'll see. Okay, can you see that now?
Oh, no, but much better. Okay.
So are there any software to use personalized learning of AI in healthcare? So then it'll give Coursera, all those online, Novo, Pathway, and Kaggle Learn, Google Colab, educational resources. It gives, and if you give the same question, I can expand it.
I see.
And type.
Oh, this is Gemini. It look like ChatGPT.
Yes, it's similar.
Similar, I see.
Yeah, references.
Normally the ChatGPT, yeah, listening.
Yeah. So then it gives references also for each and everything.
I see.
Yeah, this is very useful.
Yeah.
Yeah.
Okay, I'll try that. I'll try
Yeah.
that.
So it depends on the question. So here
I
also, this is ChatGPT.
Uh-huh.
Give elaborate matter with regard to following topics: introduction to AI, application in AI, and whatever you've given me, I just copy paste.
But then
it gave me quite a lot of things.
I see.
So I used. Of course, I use it for a lot of things. Okay.
Of course.
So
Gemini tend to give
there.
more website, right? The Gemini give you like more website, more reference.
Yeah.
Oh, okay. I'll try that. I'll try that one. Right. So I think so that thank you for answering my question. Now probably I would open for asking, the member for asking question. Yep.
Okay.
But thank Prof. Excellent presentation.
Thank you very
Yes.
much.